Even though a lot of scientific objective research was done by Masters and Johnson in the late 1950s and early 60s, from time immemorial, man was curious about the human sexual act and has been observing others performing the act, observing animals doing that, etc. Then, when the man has organized himself to be more scientific and rational, the studies were primarily subjective. What exactly is that I mean by when I say subjective? A researcher or an interviewer will ask certain questions from an interviewee or a respondent, and whatever answers the respondent gives, the interviewer will analyze, collate the data, and then come to a conclusion. This is called subjective. Why is it called subjective? Because there has to be more clarity and proper understanding between these two individuals. When a question is being asked, the respondent must understand what exactly the question and what is the data that the interviewer is seeking. And after that, when the respondent answers, the interviewer or researcher must also understand what exactly the respondent is trying to tell. Only then the data is more relevant. But as all of us know, there is always a gap between the cup and the lip. And this understanding may not be proper due to many communications vagaries. So the data was not perfect and a lot of assumptions were drawn which are not really factual. Having understood that, William H. Masters, a reproductive endocrinologist, Virginia A. Johnson, a clinical psychologist, they teamed up to study the human sexual act in a laboratory setup. Why? Simple. Unless a medical man understands the normal functioning of any system of the body, this is known as physiology, he or she cannot understand the abnormal functioning. The abnormal functioning is known as pathology. Only when a physician knows the physiology and the pathology, then he can think in terms of a medical management, medical or surgical. But that data was not available till the advent of Masters and Johnson because the subject was a taboo subject and nobody really studied that. Whereas they did extensive research as far as the heart is concerned, the lungs are concerned, the eye is concerned, stomach is concerned, etc. etc. And now Masters and Johnson set up a laboratory which is nothing but a master bedroom. They had 392 male and female volunteers. They've been asked to have sex in that sleep laboratory. When they were having sex, various data from the body have been recorded through gadgets connected to them. For example, the pain functioning was recorded through a graph called electroencephalogram EEG. Heart functioning was recorded through electrocardiograph or Holter monitor. Muscle tension was monitored, blood pressure was monitored, pupillary dilatations were monitored, so many facts. For a man, everything was external. They were able to microfilm it quite easily. Unfortunately or fortunately, for the woman, it is internal. So they could not take a picture from outside. So they made an artificial transparent plastic penis, kept a miniature camera inside the plastic penis, inserted into the woman's genitals, and took serial photographs. 392 couples, 14,000 sexual acts between 61 and 66, 5-year study. Then they analyzed the obtained data. They realized certain things which are happening to man, certain things were happening to a woman, certain things were common to both of them. So they brought out a textbook known as Human Sexual Response. Only in 66 the medical fraternity were apprised of the physiology of the sexual act in the human beings. Now, what is the advantage of that? They have categorized the sexual act into four stages, namely excitement, then maintenance excitement known as plateau. These two are combined to call an arousal stage. Then when the person reaches orgasm, it's called orgasm phase, and then the resting phase. Now, Helen Singer Kaplan, who subsequently studied this act, she added one more phase called desire phase. That means without desire, a person cannot get aroused. Desire is like a foundation for a home or a building. So today we have a desire phase, an arousal phase, and an orgasm phase. Now, once Masters and Johnson got the data, they studied what can go wrong in the body between 66 and 70. They published the second book known as Human Sexual Inadequacy, which described the various sexual problems human beings are facing in day-to-day life. But then they realized that their study population were otherwise quite healthy. They never had any other medical issues. So then a question posed, if somebody has got a heart problem, will the heart affect the sexual functioning, or sexual functioning will affect the heart? Lungs and sex. Can you have sex during pregnancy or not? If somebody gets cancer, God forbid, will that affect sex or sex affects cancer, etc., etc. System by system they studied, and the first comprehensive textbook of sexual medicine came to the world in 1979. It is called Textbook of Sexual Medicine, authored by Masters, Johnson, and Kalodny. Now, based on that only, all further research took place in the field of human sexuality for the modern physician, which is beneficial to the modern man. Now, today, the physician is able to understand in which phase of the response cycle a client or a couple have a problem, and they are able to slot that in that stage, give it a proper label. Once you give a proper label, a physician knows what type of investigative tools he or she has to use to clinch a causative diagnosis. Once we know the cause, then as a physician, the doctor knows how to handle that. It's as simple as that. That's the greatest hallmark of Masters and Johnson research.